Hello, everybody. Welcome to Millennium Live, where we dive in to the innovative ideas and the leaders that are transforming the digital enterprise and really paving the way for a brighter future. Today, I'm very happy to have Marta Bralic Kerns. She is the CEO and founder of Pomelo Care, a virtual medical practice built to address underlying risk factors to improve maternal and newborn health. Before Pomelo, she advised payers and value-based payment models at McKinsey and was the SVP of Business Development at Flatiron Health. She graduated from Harvard and is passionate about eliminating health inequities and barriers to care, which is why I'm very happy to have her uh, on this podcast today and on this episode. Uh, and just to really discuss how her and her team at Pomelo are really pioneering a model that aims to support mothers and families through every stage of pregnancy and postpartum care, which is something that we don't address enough, especially at the employer level. So, Marta, so happy to have you here on the Millennium Alliance podcast, and it's really great to talk to you.
Thanks so much for having me, Connor.
Of course. Today we're going to be diving in to the distinct approach of what makes Pomelo Care really stand out in this space and what they really bring to maternal health and the impact that they're making on both patients and employers alike. We'll definitely dive into the key measures of success in women's health benefits and how employers can really think about ROI in a way that benefits employees and the business alike. So much to dive into. I want to get into it with Marta here. So, Marta, it's always fascinating when I speak with, founders of different companies of why they started their own company and the way that the path that took them in that direction. So, just curious about obviously there's certain passions here that have driven you to start Pomelo Care, and wondering where are you the story behind Pomelo Care and the journey that got you here today.
Yeah, so I've always been really interested in a couple of things in healthcare. One is how you align incentives in such a complex system, trillions of dollars spent, so many different stakeholders. There's providers, there's payers, there's patients, there's employers, only playing a bigger and bigger role as the payer. And I've always been fascinated about how do you align incentives across all of those groups in order to achieve what we all want, which is great health outcomes for people. And so I started my career, as you mentioned, at McKinsey doing consulting, actually on the government side with state Medicaid agencies to help them figure out payment models that incentivize better maternal care. So we're specifically looking at maternity as an episode of care and saying, what can we do to improve outcomes and improve how we pay for this care to make sure that we're driving to the outcomes that we actually want. And it was just eye-opening to see how many challenges there were in data and being able to understand what was actually going on and the dynamics between the providers and payers and what patients were actually having access to versus what they should have access to. So I very quickly kind of went down this rabbit hole of how do we use data to improve these incentives and make care more what it should be. I continued that in the cancer space at a company called Flatiron Health, where we are working on personalizing care for patients with cancer, depending on what type of cancer they had, what type of care they needed, and actually measuring the outcomes of that care. And then I had two kids, and it felt like everything I worked on professionally was completely out the window. There was no, predictive modeling. There was no, understanding someone's personal risks and goals and what they specifically need and matching the care system to that. It just felt like going back, 50 years relative to the work I had been doing professionally. And so I kind of looked around and what existed and what the missed opportunities were. And You barely need to like scratch a little bit. I'm sure employers feel this way when they, look into maternal health. It is very obvious that we have massive gaps in care that we're
Mm.
able to provide for people across this country. There's not enough obstetricians. There's not enough high risk OBs. There's not enough visits. There's not enough support for people, and the rate of complications is increasing. So the number of people who have a high risk pregnancy is going up year over year. The percent delivered preterm is going up. The percent of babies in the NICU is going up. So it's almost on like every measure, you see things going in the wrong direction. And I kind of took a step back and said, okay, what about, all these things like value-based payment models or better predictive analytics? Do these exist? Are we doing this to, try to improve the trajectory we're on? And I just felt like a lot of it was missing. I felt like there was a lot of like digital engagement tools, a lot of educational resources, but I felt like none of the solutions went deep enough to really address the root cause issue, which is there are more high risk pregnancies and there's not enough providers to take care of them. And we really need to reduce the risk of each of these pregnancies for people to help them have a healthy baby.
Yeah. Uh, a lot to unpack there, Marta, and thank you for taking the time and also thank you for being somebody who is up for the challenge to address these huge issues that are not only affecting so many people in the United States today, but are having a real major impact. And one of the things too that we discuss on the show is that how that translates to being at work uh, to your personal life. And a lot of us do bring our personal lives into the workplace. And I think that's you alluded to how this is really a major issue. There's so many different aspects of policy and availability of resources that is in doubt and in question for sure. So you could certainly call this a big issue, a big, very important time to have this discussion. And speaking of the workplace, how is this maternal health emergency really in the U.S. impacted the ability for employers to offer solutions to their employees and to make sure their employees are properly taken care of at a time when they really truly need it?
Yeah, I think it's really become clear in the last couple of years that employers are going to have to step up in this area, and they really have. Now, over half of employers offer a maternity solution to their employees, which is much higher than it used to be. So we are seeing employers kind of step up, and the reason that they are is because it really affects both their workforce and their workforce engagement and retention and recruitment, but it also really affects their healthcare costs. So starting with the engagement, recruitment, retention, if you are trying to conceive and it is not going well, if you are pregnant and there are complications that you're worried about or you're really anxious about your pregnancy, if you are postpartum and not getting the support you need, you are very unlikely to be very engaged at work. And in the postpartum case, you are more unlikely to come back to work
Mm.
after your maternity leave. So we see 24% of women not return to work after maternity leave. That is a huge number.
Mm.
But even if you are, prior to that and you're working, but you're trying to conceive and it's not going well, or you're pregnant and you're worried about complications, you are not your best self at work. You are not 100% present. You are not, focused. You're not, doing the best work that you can. And unfortunately, in the status quo, you have very little support around you during that time. You have very little, recourse. If you need extra OB visits. That's not really built into the system. You can't, go in for a same day appointment because you're nervous about something. You really get sent to the hospital in all of those cases. And that brings us to the second piece, which is all about the cost of this episode. So if you're an employer, you're facing, it looks like we're projecting something like 9% increase in healthcare spend next year. That is enormous. That impacts every employer's budget.
Mm.
That CFO is looking at that, saying, right now we need to budget for 9% higher, healthcare expenses next year. Whether you're self-insured and you're paying your own claims, or whether you're fully insured and your premium is going up, either way, you are feeling this. And you're looking at those rising costs. And pretty typically what we see is one of the top three cost categories is maternity and NICU.
Mm.
Those NICU costs, because the higher rate of high risk pregnancies, the higher rates of preterm birth, the higher rates of NICU admission, we're seeing NICU you consistently be a top three expense for employers. And when they look at their hospitalization expense, which is always what you look at is really big bucket of spend, and often avoidable spend is captured in that hospitalizations bucket. 21% of hospital expense is coming from maternity and infant related hospitalizations, including the NICU. So you're looking at this, you're saying, my employees are not, bringing their best selves to work. They're not getting the support they need. And I'm paying, a ton of premium dollars or claims cost on these avoidable complications. Is there a way here to actually reduce the rate of complications, reduce the cost, and invest in my employee well-being in a way that pays for itself? And that's what I think is really unique about the maternity episode. Is it's a short period of time. It feels long whenever you're pregnant, of course, but relative to chronic conditions or something like that, we're talking about a relatively limited period of time in which you can provide something of huge value to the employee, but also recoup cost savings from NICU and other hospital utilization in order to pay for the program to pay for itself. So you can offer something really beneficial to your employees and have the cost pay for itself.
Mm. That's those numbers are incredibly fascinating, and I feel like you don't hear those numbers enough in order to understand how serious this problem is going to get in the future if it's not addressed. And
Exactly.
I want to definitely bring in Pomelo Care into this conversation and talk about the model that you have and how you're working with families and working with patients and working with employers specifically to really address this because you know there are different solutions now that are coming to light and that's a good thing, but you know what makes Pomelo Care stand out from the crowd in terms of the mission, in terms of the model that you're using to address these issues?
Yeah, so a little bit about us. Pomelo Care is a 24/7 virtual medical practice that provides care to people when they're trying to conceive, when they're pregnant, postpartum, and for their baby until their baby turns one. So we are available in the least friction ways for patients. So they can take out their phone and they can text us. They can use our app to get in touch with us. They can book an appointment with us. They can ask for an on-demand appointment with us. They can call our practice. Our job is to be very, very easy and frictionless to access so that if you have a minor concern, you're reaching out to us right away before that gets escalated, before that becomes a complication that could have been avoided. So we provide medical care, we provide mental health care, and then we also recently completed an acquisition of the largest doula network in the country so that we can also provide doula care in person and virtually. So we can be in person in the delivery room as well with folks when they kind of need the support the most. And our job is to work together with the healthcare system, right? Not add another layer on top of it, but to work together with the patient's primary OB who is overwhelmed and has a lot of things to do and can't necessarily see that patient between visits very often, to fill gaps in care, but also identify and get ahead of potential complications as early as possible. So a lot of what we do is focused on understanding early on in pregnancy when people don't even see their OB. Most OBs won't see a pregnant person until 8 to 10 weeks of pregnancy. Typically, that's when the prenatal care starts. Before then, there are so many questions, everything from nausea and vomiting to potential miscarriage or bleeding that people are dealing with often by themselves at home with very little support. So we start all the way upstream to identify what is a particular person's goal. What is your goal this pregnancy? Is this your first pregnancy? Is this your second? Do you have specific goals? Do you have specific concerns this pregnancy? And then we're also using the data to understand what risk do they have based on everything we know to be linked to preterm birth, linked to NICU admissions, and then working with patients on a very high touch care model, care program to reduce their risk. So to give you some examples, we're looking at who is at risk of preeclampsia, which is one of the main reasons that babies are born prematurely. Who is at risk for gestational diabetes, another reason that babies might be born early, and also a reason for NICU admission. Who has risk for mental health concerns and complications that might also impact both their health and the pregnancy and the baby. And then we're working on specific care programs with those patients to make sure their blood pressure is in range and they have the right medications, to make sure their blood sugars are in the healthy range, and to make sure that their mental health symptoms are improving. So this journey can look different for every patient, but we have doctors, nurses, midwives, therapists, lactation counselors, pediatricians who are working with patients really around the clock whenever they need the support, both when they reach out to us, but also proactively on reducing some of their risk. So you asked, what makes us different? I think it's that depth that is actually working backwards from the bad outcome, working backwards and say, okay, what can we do to prevent the preterm birth? What can we do to prevent the NICU admission, and making sure we're going really deep with someone on their care, not just providing them education, not just providing them some content, but actually working really deeply with them to identify these are risks that you have, or these are goals that you have. Let's work together to get you the best possible healthy outcome. And I think that's the difference between, check the box point solution. That's okay. I have something in MSK. Okay. I have something in oncology. Okay. I have something in maternal health, where you're offering something and it's better than nothing, but there's no real mechanism for that, digital app, for example, to move the needle on the root problem, which is the high-risk pregnancies and the costs associated with them, and of course the employee experience associated with them. So the real difference with us is we go that extra layer deeper. We're much more clinically focused. We fully employ all of our care teams, so it's not like a loose network model or something like that. We really are medical and behavioral health professionals and doulas that are working as a team for the employee to make sure they have the best possible outcome, which will actually translate to cost savings for the employer.
Mm, that's incredible. Just out of curiosity, Marta, when did you start Pomelo Care?
In 2021.
Okay, cool. So, I mean, this is even a very young company, who doing amazing things, and really designed to tackle those challenges of healthcare, which is improve patient outcomes and an overall better experience, for members. But
Yeah,
you know,
exactly. What we've seen in that time period is just tremendous demand from health plans and employers for these types of solutions. So we are already covering 15 million lives in the US today through our contract. So we have seen just an explosion of need and demand, as I think people recognize the problem. They're seeing the headlines, they're seeing the costs, and they're seeing their employees and team members ask for solutions here.
solving the challenge of even in especially when it comes to the workforce, as you have on your website, 1 in 10 babies start their lives in the NICU. I was one of them. Over 40% of new moms are leaving the workforce. That's a big problem, and that's a big number. And 1 in 8 families are struggling with fertility. So there's a lot of different issues that cover so many different ground. Because when you think of, maternity leave, you think of, someone's pregnant in the office, then they take their, however allotted time that they have, and it goes so much farther beyond all this. So what's the differentiator of Pomelo Care when it comes to employers?
Yeah, I think it's really working with them to understand what is your benefit strategy, what is your cost strategy, and being a partner to them to customize at what we can offer based on where they are seeing in their particular population, where they're seeing the need. So we have employers, for example, who invest in really generous fertility support for their team members, but they find that, okay, I might have this fertility benefit in that I'm willing to, compensate for the services that patients need, but it can still be very difficult for the employee to know what benefit they have, to know how to access it. And just because you have something paid for doesn't mean it's easy. These are grueling journeys, these fertility journeys, and so employees, patients, they still need more support than they're getting today. So in a situation like that, we'll work with an employer to say, yes, you have this benefit, but is it being utilized the best? Are you getting the best possible outcomes from it? And we'll actually help employees know about the benefit, make sure that they're able to access it, but also provide all the care that surrounds it. So, for example, if you're going through challenging fertility journey, you probably have pretty high mental health burden of that journey. So we have specialized mental health resources that are specific to this period of time, that are specific to fertility journeys, pregnancy journeys, and postpartum journeys, which look quite different than your mental health outside of those time periods. So we have that on one end of the spectrum. We have employers that are really passionate about offering doula benefits to their workforce. And they know, people need more support, specifically at the time of delivery. And they're also want to moving the needle on health equity, which we know doulas is one of the very few proven solutions to actually reduce disparities in outcomes. And then we have employers that really want to support the entire journey from fertility, pregnancy, postpartum, but also other phases and stages. So pediatrics, extending much further, and then women's health journeys extending much further into, menopause or other specialty conditions that disproportionately affect women, like rheumatology and things like that. So we have run the gamut. So I think what's really unique about us is, again, we're a medical practice. We're very clinically deep and robust. So we can partner with employers to say, let's take a look. Let's take a look at your claims. Let's take a look at your experience to date. What is actually going on in your population? What are you hearing from your teammates? But also, what are we seeing in the data to craft a solution that's actually going to go deep enough to address the root problem that you have and make your employees happier, healthier, but also pay for itself on the claims cost side.
Absolutely. And I think it's a great transition to talk about the success that you're seeing out in the workforce and in general. One of the good things about having strong solutions are seeing the success stories, the case studies that are tangible evidence that this works. And curious about what you've seen, Marta, in the short time that Pomelo Care has been around and the sheer number that you're affecting already in a positive way is certainly um, worth telling and worth sharing about on stuff like this. So, what are some of the results that you've seen, just even in general, or if there's a particular story that stands out to you that you've seen with your partners and your patients that are using Pomelo Care and have seen better results for that, just being a partner of yours.
Yeah, absolutely. So we said from the beginning, again, we're building a clinically robust model that we want to make sure is actually moving the needle where it matters, that is improving outcomes and reducing costs. So from the beginning of when we started seeing our first patients, we've been really rigorous about implementing that care model and collecting and publishing data to show the results of that care model. So where we are today, I mentioned we cover 15 million lives across the entire country. We have a net promoter score among our customers of 90, which we are extremely proud of at that scale. We have shown clinical results that we have published at some of the leading medical societies. So if you've heard of ACOG, it's the American College of Obstetrics and Gynecology, or SMFM, which is the High Risk Obese Society. We've published data at both those conferences showing, number one, our preeclampsia prevention program is working to make sure patients are getting the right interventions at the right time to significantly reduce their risk of preeclampsia by 25%. We've shown our mental health screening rates are 7 times higher than baseline, which has been shown to reduce prenatal and postpartum depression risk by 40%. We've shown that we can increase screenings to identify risk by over 4x the standard. We've shown that we can reduce ED visits, so those emergency room visits during pregnancy, by 46% compared to people who aren't in the program. We've shown very significant reductions in NICU admissions as well as length of stay in the NICU. And we've shown reduced hospitalizations unrelated to birth, so the kind of like unnecessary hospitalizations during this period. So all of this, together culminates in a 2-to-1 ROI that we've been able to show for our customers. And we're actually continuing to publish data. We have an upcoming data I can't share quite yet, showing a reduction in total cost of care across a pretty large population. So we're continuing to publish the results of everything we do. It can be hard sometimes with the statistics to really think about individual patients and what this means. So I can share a very, very typical kind of patient experience with us is someone who comes to us because they have a challenging, let's say, time trying to conceive. 1 in 8 women in the US has polycystic ovary syndrome. So this is a hormonal condition that can make it harder to conceive. It can also cause higher risk in pregnancy. Very often we're seeing folks with some kind of challenge very early on in their planning and fertility. We're working to support them in a really detailed way in trying to conceive. We're working with them. We send them ovulation kits to their house. We're working with them to track their cycles and help them optimize their fertility journey and planning. We are referring them if it's appropriate. We're getting lab work done. We're referring them when it's appropriate to a fertility specialist or reproductive endocrinologist. We're making sure that where we're sending them is someone who really high quality. We're providing the mental health care during that experience. We're following up to make sure that they're getting the care that they need and that their questions are being answered along the way. We also provide peer support during this time because it can be so challenging and so lonely through these journeys by yourself. So we offer peer group sessions where women are meeting with other women who are going through the same phase of journey, whether that's infertility or the same stage of pregnancy or the same stage postpartum, and they all bring their babies to the session. So we're really providing this holistic model of care, including nutrition, which is really critical in polycystic ovary syndrome in particular. Now, once that patient achieves pregnancy, obviously everyone's very excited. It's also a higher risk pregnancy if it was, IVF or PCOS. So we're from the beginning continuing to work with that patient on their nutrition, on making sure their blood sugars are in a healthy range, given the risk of developing gestational diabetes from that point. So we're working very early on in the pregnancy to reduce that risk, continuing the mental health support because that's also so linked to the outcome. And we're continuing the peer support. Once that patient, if they do get diagnosed with gestational diabetes, we have a very detailed nutrition program that helps with meal planning and deciding, what to eat every, particular meal in order to make sure that your blood sugars stay in this very, healthy range that we're looking for. We're doing birth planning. We're matching that patient to a doula. We're handling all of the inquiries, all the urgent care, all the, I have this pain or I have this symptom or I have this question. Is it safe to do this? Is it safe to do that? I was up in the middle of the night. How can I sleep better? My mental health is, taking a toll. And basically whatever this person needs during their pregnancy, we are there for them. We typically respond in under 10 minutes. Our average response time right now is 6.5 minutes. Which again, at a large scale, we're very proud of because even if it doesn't seem urgent to a medical provider, maybe the primary OBGYN, this isn't the most urgent thing they're dealing with that day. But to this patient, to this person, they're staying up at night worrying about this, or they're, sitting at work worrying about this, or, this is really affecting them. And so we respond really quickly, again, across a range of issues, medical or mental health related. And then, of course, we provide the doula support during birth, so helping to identify, when's the right time to go in the hospital, helping with a birth plan, and then advocating for a patient's preferences during birth. If they want certain interventions or not, and helping them really advocate for themselves in that doula capacity. Again, now we can actually send doulas in person to labor and delivery to support patients having the birth experience that they want. And then postpartum, we know is a really challenging time for most families. We have a postpartum care program that works on mom's health, that works on lactation. So we provide lactation support for everyone in that postpartum period. We screen and treat for mental health in that period. And then we also, if there was a NICU stay, we're helping the family transition home from that NICU stay, make sure they have the supplies they need, make sure they're ready to feed the baby, take care of the baby, that they have medications that they need at home. And then give them that assurance once they're at home, because again, we're available around the clock. So, in the case of this patient example, if they did, have a baby in the NICU, they might be home with an apnea monitor or something like that. We're available 24/7, so they can call us, and we can triage and provide that care almost instantly for them. And then when it comes time to return to work, we're there for a full year. So really anything that might come up for mom or baby, including many, many fevers, rashes, newborn concerns, feeding concerns, introducing solid foods. We're there for that whole journey to just provide that peace of mind, and also save the person a lot of time that they otherwise might have spent navigating lots of different doctor's appointments.
Wow. That is thank you for taking me through that, because it's so interesting, even coming from somebody like me who's a male and who may not be thinking about this all the time. There's so much that goes into the care of just even the thought
Yeah.
of you're ready to have a baby, you want to start a family, you're not even sure potentially where to even begin. Pomelo Care sounds like the place that your answers can be answered, or your questions can be answered. Really fascinating, and it's really, this is a great episode for me too, because there's so much that didn't know existed, and that I didn't know goes into this. So thank you, Marta. I want to just ask you a few more questions before I let you go. And it's kind of focused
Sure.
around ROI and of course the future of where all this is going. But I want to get to a point that I made in the introduction. If you were in your employer partner's shoes, speaking of the employer, how would you evaluate women's health benefits for your employees? You've kind of touched upon this a little bit throughout the podcast, but how would you think about the return on investment and key measures of success for your business and employees? Because one of the things that's so valuable to a business are really great employees, and if you provide them with the best care possible and the best options, then that's only going to mean great things for your business. So, where do your employer partners stand right now in terms of women's health benefits, and accessibility and things like that?
Yeah, I mean, I think you kind of said this at the beginning, but I think employers have taken on so much more of the burden of the American healthcare system, and stepping into the shoes of what providers maybe should be doing, or health plans maybe should be doing, and they've taken on
Absolutely.
a lot of that effort. And so I think what's happened, especially since COVID, there's been a proliferation of solutions that employers have brought on. And I think now there's a little bit of a reckoning of saying, okay, I've brought on all of these different solutions. Point solution fatigue, everyone knows well. But I brought on all these solutions, and what impact have they actually made? Because now I have rising claims costs, because my premiums are rising, or my claims costs are rising. And I've also incurred a lot more of this additional expense that I'm putting on top with all these different solutions and vendors that I have. What's actually moved the needle and what's actually working? And I think when they peel back the layer on a lot of these solutions, what they're seeing is I'm actually paying for a lot of services and care for a very low acuity population. And the level of care they're getting is like a very digital experience, very content focused experience. Are people actually meeting with a medical professional? Are they actually getting, care that is going to change the course of their journey, change the course of their cost. And I think they're starting to say, no, like we're actually just adding a bunch of additional care for people who otherwise wouldn't have been complex, otherwise wouldn't have been high risk, otherwise wouldn't have incurred a lot of cost, otherwise wouldn't have been absent from work or left the workforce or anything like that. So I think what we're seeing now is employers really getting much more specific on what it like. Let me actually look at my claims costs. Let me actually look at what's happening. And let me make sure the solutions that I'm choosing to continue or to bring in new are addressing a real problem, and actually be a high cost area and actually the right subpopulation. Because if you take a high cost area, but then you just engage the low cost people within that area, right? Like the MSK, but you
Mhm.
actually don't engage everyone with that's going to have surgery. You actually only engage the people who have mild, to moderate symptoms and never would have been surgery candidates anyway, then you're not really addressing the root problem. And I think the same thing has happened in maternity, offering, pretty, light, broad solutions, light touch and pretty broad solutions that, of course, table stakes, like you provide a better experience, provide more education. And it's amazing. I think these experiences for employees are amazing, but they just need to go another layer deeper to say, okay, but we're actually addressing the high risk people, the people who are more likely to drop out of the workforce, people who are more likely to be absent, people who are more likely to incur a lot of costs, and the people who are more likely to have a bad outcome. And we're actually tailoring solutions to meet the needs of that higher acuity, higher risk population in a way that actually delivers medical care, that delivers the right interventions at the right time to change the course of care. So not just, again, reinforce it or provide more education or support, but actually change the course of care to reduce someone's risk, make sure their blood pressures are in control, make sure their blood sugars are in control, make sure their mental health is improving, so that they're actually fundamentally less likely to have a preterm birth or a baby in the NICU and incur that bad outcome for their family, which is first and foremost what we care about, but then also provide that cost savings for the employer to fund the program and fund other initiatives, frankly, that they would want to be investing in.
Marta, I like to end the podcast talking about the future and kind of wisdom. I know you don't have a crystal ball or anything like that, but I think it's important to discuss, where all this is going. And we've discussed the challenges and we've discussed the solutions that are happening right now. And as you know more than anybody so far, I've talked to you probably this year, of the rapid growth of, solutions that are not only helping
Yeah.
your customers, but and patients, but where all this is going in terms of that really quick turnaround is probably really fascinating and to hear. And I kind of want to get your thoughts on where you see, the future of women's health benefits in the workplace and beyond, and like Pomelo Care, the innovations that are set to really drive this crucial area forward. How do you think women's health benefits will continue to evolve, expand, innovate in the years to come?
Yeah, I think the problem is really well understood now. We used to have a part of our overview slides when we met with employers was like all about the problem, and we actually took it out, about 2 years ago because it was just so clear to employers. They would say, "Yeah, yeah, I know, it's a really big problem," and so we actually ended up, taking some of those slides out. So I think like step one was like understanding that there's a problem. And I think that's really, really well understood now for a whole host of reasons. And I think a lot of light has been shown on the maternal health crisis in the US, which is a really good thing. That has led to, again, a good thing, a proliferation of solutions. Now for an employer, there's so many options to choose from. There's so many things that you could say, this is what I want to do, or, I want to do something else. So I think where this is going is to more consolidation on, what actually works. I, as a sophisticated employer, as a benefits, leader, I want to see the solutions that have published data. I want to see the solutions that have ROI, and that can point to, this is actually how it works. This is how I'm going to get the, higher risk patients engaged. This is how those higher risk patients' journeys are going to look. And here's how that's going to ultimately improve their outcome and improve their cost. So I think there's going to be much more scrutiny in a really good way that's going to elevate the bar, that's going to make sure that anyone who's playing in this space is actually delivering results to employers. So I think employers are in a really great spot now, because of the number of solutions, to say, okay, now we need to see what actually works, and that's what we're going to want to implement for our teams.
I think they're in a better place through leaders like yourself and those who are definitely making and having a big impact on this space. And it's Marta, this has been such a wonderful chat. I wish we could probably have the time to continue on for another hour or so, just to talk more about how Pomelo Care is really at the forefront of supporting mothers and families through every stage of pregnancy and postpartum care. Thank you so much for taking the time to chat with me today. I can't wait for our audience, especially our benefits leadership audience, to check this episode out. It'll be available everywhere that you listen to podcasts. And I can't wait. Hopefully, Marta will have a part two to this at some point next year, because with the rapid change and how things change so quickly, next year we could be having a whole nother discussion.
Absolutely. Thank you so much for having me, Connor. This was really fun. I hope next year we're starting to bend some of these trends that we've seen, go in the wrong direction for so long. So I hope we're having a more positive conversation next time, but it was really great to talk to you.